A lot of discussions out there about ADHD, but today we are going to be diving into ADHD. My name is Dr. Debbie. I'm a mental health clinician, doctoral prepared psychiatric mental health nurse practitioner, and I practice in United States. But my health talk, this educational video to impact people and just to create awareness and give education to people, about mental health, for positive mental health. And I appreciate tuning in every time to my channel. So today we are going to talk about this important topic. Most of the time it affects children and also adults if it is missed early in life. So we are going to be looking at about ADHD, and that is attention deficit hyperactive disorder, which is a developmental disorder characterized by inattention, hyperactivity, and impulsivity, and it interferes with social and academic activities and functioning. Symptoms, of ADHD, usually, before one can say this is ADHD, has to be ongoing for about 6 months, and onset usually occur before the age of 7 years, but in any case it must be present before the age of 12 years, since we have said it is disorder of childhood, is common among children. Symptoms are present in multiple settings, that is at home and at school. So most of the time we want to get reports from home, how the child is behaving and the concerns of the parents, and as well from the teachers. So most of the time we want to get reports as well from the teachers, from the minder, from the daycare, and then we combine both. It's most of the time, if the symptoms are missed, it can persist into adolescence and even into adulthood, and we have 30% of such individuals that are affected that fall into that category, because maybe if it is the inattentive aspect, that they have short attention span but they are not hyperactive. So most of the time it's being missed that, oh, maybe they are slow learner, or maybe they are just it is just a kind of attitude, but they missed it. Some parents, they do not give attention. It may not be their fault, but they don't know better, and then it's carry on into adolescence or into adulthood before it can maybe diagnosed. And the ADHD is actually due to low dopamine, which is a brain chemical involved with reward and motivation, and then the prefrontal cortex of the brain, it has high utilization of dopamine with its connections to other brain regions that is responsible for attention, decision making, and working memory. The prevalence of ADHD is about 9 to 1. That is male to female, is higher in male children than female. And as I've said, the type, it could be inattentive alone, it could be hyperactivity type, or at times it could be combined. Causes most of the time, generally is genetic, family history, hereditary, and the cause could be unknown in some instances. But we have predisposing factor. ADHD has higher rates in children that are born prematurely, or prenatal or perinatal conditions of infections, during pregnancy, in the newborn, or during the delivery, the process of childbirth, during the labor, either infection to the mom or to the baby that affects, the brain, or some generally infections and trauma. And also environmental exposure, to toxins like alcohol, like smoking, tobacco, cigarettes, drugs, could impact, the child. So it is very important, for babies, either during pregnancy or in the newborn, their early days, their early years, that we protect them from every kind of exposure that could impact, their development, their brain, and could lead to problem that most of the time maybe lifetime, except it is being managed properly. And what are the symptoms? It's usually of short attention span, constant failure in school, inability to see through class. They're always very restless, inability to wait in lines, inability to wait, their turn. They are always very interrupting. They want to go before every other person. Communication disorder, and in some instances, people self-medicate, like in adolescents and young folks. Then they get into drug abuse. School failure and physical trauma as a result of impulsivity, mood disorder, and disruptive behavior. The diagnostic testing is usually by psychological testing, by psychologists, and then by mental health professionals as well. And then we utilize varieties of screening tools, which usually take time because we just want to rule out a lot of things, because like most of these developmental disorder, they overlap, like with ADHD, with conduct disorder, with a lot of things, or generally anxiety or adjustment disorder as the children are growing. So we want to really be sure what it is, so that we'll get the appropriate diagnosis and appropriate treatment. But most of the time, there could be delayed treatment, delayed intervention or diagnosis. Like I said, if it is the inattentive, it's usually missed. Or even if it is combined, some parents, maybe because they do not know better, because of ignorance or denial, they delay such treatment, or it is missed completely. And that, it could continue into adolescent or into adulthood, and then some other complications could come up from that, like conduct disorder, antisocial behavior, or even substance use or mood disorder, and learning problems, which may continue throughout life. Some continue into adulthood, and the impulsiveness and accident prone continues. What are the treatments for ADHD? Generally, psychotherapy, psychological, socially, and specialized educational techniques, and we do a lot of psychotherapy and psychoeducation to educate both the individual as well as the family. Then the parental education, we talk to them about structured environment for reduced anxiety and positive reinforcement of behavioral interventions. Yeah, so that can target both academic and social activities. And then of course we make use of medications depending on the presentation, and then we'll be able to know which is appropriate for that individual. Children with ADHD may need individualized attention with teachers and at home. They may need reinforcement by the parent to remind them several times to do simple tasks due to impulsivity, and then their explosive behavior or irritability and short attention span. So we should not just be saying they are having attitude, or they are not following instructions, and or a stubborn child. No, they need support, they need a lot of patience, and that will help them, the more the support, and then with the treatment, for them to adjust effectively. And also there are a lot of accommodations can be can be utilized for these children, like clinicians can write a referral letter. In the United States here, there is 504 plan, there's IEP, that is individualized educational program, where they allow the child, depending on the severity of the presentation, that maybe we need one-to-one teaching in the class, or we need a smaller group, maybe group of 2, group of 3, group of 4, where they are less stimulated, and then their restlessness and hyperactivity is well controlled, and then their attention can be focused for their learning needs in the class. So for them to be able to complete their schoolwork, and as well accommodation for test taking if they need extra time to complete their assignment, their classwork, or during the test. And even like when people grow into adolescent, those that are mixed or adult, a lot of people will write letter for them for accommodation, or even to test like board exams and all that this individual will need this type of accommodation, more time than regular students, and is usually honored by any institution, any place of work, or even people's schedule. I've had some of my patients that they are not able to do maybe like the 5 straight work Monday to Friday or whichever day, and then we write such accommodation letter for the employers so that maybe they will want to be working 4 days a time a week, or yeah, they just make it so that they need more time to, or maybe they extend, if the work is like 4 days, they can extend it to 5 days with shorter hours, and then they are able to perform effectively. Children with hyperactivity type are more likely to be referred for treatment on time than the inattentive type, because children with hyperactivity, they can really be disruptive, many of them breaking objects, fighting, argumentative, disruptive in class, and a lot of chaos going on in the classroom. So because of that concern, or at home, they usually get attention, and then they get the treatment that they need. But the attentive type is the one that I've said several times in this educational video that is being missed. And of course, we use social skills for behavioral modifications for them to properly adapt, how to wait for their turn, their communication. And then at times, many of them, they are the one, like during tests, they will just answer a few questions. They always miss a lot of questions. They are forgetting things, forgetting keys, or like adults, when it is carried over, they forget to pay their bills. It's not that they do not have the money, they don't remember, and so many things like that. But with the treatment, with the support, with psychotherapy, they are able to live a normal productive life. And I hope we learned something. So it's not like the myth a lot of people, that there may be other things, like I said, it's overlap, but it's very common now on the social media, like people, maybe it's even maybe stress, it's anxiety, is a different diagnosis entirely. People just diagnose themselves, or they even recommend some of the people that come to see us that, oh, my friends are saying that probably I have ADHD, or like my friend is having it, and I think no, it's not. And the to go through the screening tools, or the diagnostic, the evaluation process, it takes a day. We can order for lab work. We order for lab work. We do a lot of questioning and all that. I want to know the history, the complete comprehensive history taking about. We ask about childhood. Did you drop out of school? How was your primary, your elementary school growing up? And did you use steady accommodation in school, like special program and all that? And then at work as well, like people, they change your job rapidly. They stay here 3 months, they are gone 6 months there. They don't have a straight line work history. And their relationship as well is very difficult for them, to be in a good relationship with people, because they are like, they are bullying everyone. They cannot wait for their turn, and then people are not able to accommodate them. But when they come for treatment, and then we are able to rule out that it's not any other condition that is overlapping or that is mimicking that, then they are able to live it normally. I hope you learned something. My name is Dr. Debbie. As I've said, I'm a mental health clinician, and my goal is for positive mental health for everyone, that people can come forward, to get the help that they need. And then you check my bio to learn more. And any question, any discussion, you can send an email that for any clarification or question you have. And if you live in Maryland or New York in United States, I have a daily practice, that I reach out to people to be able to create more access to many people. And many of my patients, they are happy, they are doing well, they are going on with their work, they are going on with their school, with their academics, and life has been good for them. So this is New Year. Let's work together. Let's encourage, support one another, and please like, share, and comment on this video that some other people too can benefit. Until I come your way again, have a positive mental health, and see you some other time. Bye.